Hello, I'm Professor Dragoș Vineranu from the University of Medicine and Pharmacy, Carol Davila from Bucharest, and I'm going to give you some hints about angina pectoris. Angina pectoris is a very important symptom. Angina pectoris is a chest pain, which is usually in the middle of the chest and usually takes less than 5 minutes. Be very careful. If this chest pain takes more than 5 minutes, it might be an acute coronary syndrome. It might be heart attack or myocardial infarction. And in this case, go to the hospital, ask a physician to do an ECG and to check if there is or there is not an acute coronary syndrome. What you should do if you have angina pectoris. Angina pectoris, if it's less than 5 minutes, chest pain I mean, you have to go to a general practitioner and see if you need to see a cardiologist. If you need to see a cardiologist, probably he will ask you to have an ECG, to have an exercise test, or to have other tests such as CT scan or an angiography of the heart in order to see the main arteries of the heart. If you have angina pectoris, if it is a definite diagnosis of angina pectoris, you will be asked to change your lifestyle and probably you'll be put on some medication. If we are speaking about changing lifestyle, it is very important to control your diet and do some exercise. And of course, you have to stop smoking. In terms of medication, just be very careful in order to decrease the blood level of lipids and to control the blood level of glucose. These are very important risk factors which should be controlled in order to decrease the risk of myocardial infarction, to decrease the risk of progression from angina pectoris, which is a chronic syndrome, to an acute coronary syndrome. And of course, it's very important to control your hypertension, to stop smoking, and to take some exercise. Thank you very much for your attention.